project that we are doing called SIMBA is studying the effect of mammography plus breast MRI compared to mammography alone in women with a personal history of breast cancer. At the time that I was trying to put this project together, I was pursuing the traditional route, which is to apply for research funding from the National Institute of Health. And at the same time, I was being trained in doing patient-centered outcomes research. So I took the research idea that I had and then tried to find women to partner with in our community about how to make this project more relevant to patients and clinicians.
What we need to do is actually get more primary care providers and more clinicians who are actually there in the trenches to participate on these kinds of studies. And I think with regard to the stakeholder panel, for me, it's been very educational to be on the same panel with radiologists, medical oncologists, health services researchers, patients, and myself representing the primary care provider.
In our project, we are working with 2 patient partners. These are women who've had prior breast cancer, and they are involved in all of the research activities.
We're in meetings, we participate in scientific phone calls, we do presentations, we coordinate the local advisory committee. We're kind of there to ground people in a way.
When we first started, that was a very intimidating room to walk into, knowing how much schooling they had, how expert they were in their field, and I didn't know what we could offer that they wouldn't already know. But as time went on, we realized that they were willing to listen to what we had to say about a patient point of view, and we really formed a relationship where we had open exchange of ideas and conversation.
It has just really been fun to see how much give and take there is and how much the stakeholders and the researchers learn about each other. I think that's been one of the strengths of the project.
A lot of people have knowledge, but you don't know how to share the knowledge. So I believe that SIMBA created that platform to begin with, trying to understand ourselves, what do we want to do, and how we can help through professional guidance.
I've typically done studies mostly looking at data and not necessarily interacting with the patients. And so watching them interact in the scientific meetings has also been beneficial, just in terms of they provide insights and ask questions that I think none of us think to ask as researchers. And they also help us bring it back to, well, what is this going to mean for the patients?
It's really important that the patient's views and ideas do not get overshadowed and overlooked, because sometimes the doctors or the stakeholders don't always think about everything, and then they're like, aha, so that's how the patients feel.
This is unique, and we're using our patients to help direct the research. If you give a research question to a group of doctors and you say, what should we study? They say, survival, recurrence, and morbidity. And but you ask the same question to patients. They say, how am I going to feel? What am I going to look like? What is my relationship with my family going to be?
Sometimes, speaking the same language, sometimes you don't even think of what you're saying, that the person may not understand the lingo. So I think that can be kind of challenging, but an important thing to consider is that everyone is understanding the same information in the question that's before us.
The patient voices have been heard in this study, and I think that we are evolving our methodology to answer some of the questions that the patients have had. And I think that that is clearly missing from some of the other research that we do.
I really want to find and develop opportunities to engage patients much more in the research I do. They really are key to defining the most salient problems, research questions to address. So from point A, involve the patients, and then continue incorporating them and integrating them into the research team throughout.
Having the patients involved in particular helps to remind the whole research team that there are real women behind the data that we look at, and being able to keep our research honest and relevant to real women is what makes this structure and this project different.
I have learned so much about how research works. I've learned how to interact with oncologists and biostatisticians and people from all different walks of life. And I think that we can make medicine better by working together.